Welcome to our final poster presentation titled High to Low, the Effects of Marijuana Use on College GPA. This research project was put together by the group The Methodicals for our class Research Methods in Psychology. The purpose of this research project was to determine how different levels of marijuana use affect an individual's college GPA. Our hypothesis was that higher marijuana use in college students would lead to a lower GPA. Marijuana is the most commonly used drug amongst college students, and it becomes increasingly more prevalent. This study is essential in order to substantiate research asserting that high levels of marijuana use can have a detrimental effect on a student's GPA and overall academic performance. Prior research has detected a strong correlation between marijuana use and a lower GPA. These previous studies show that high use of marijuana can result in consequences including social interpersonal skills, additional risk behaviors, increased dependency on marijuana, negative self-perception, and academic and employment failure. Excessive marijuana use is also directly linked to altered brain functions, impaired decision-making skills, memory loss, and impulsivity. Studies also show that high levels of marijuana use are directly linked to an increased dropout rate, missing class excessively, cognitive impairment, behavioral misconduct, and a decrease of academic motivation, which ultimately can postpone graduation and decrease academic performance and overall result in a lower GPA compared to students who do not use marijuana. The measures we evaluated in this research project included a comparison of GPAs of students who never used marijuana or moderately use marijuana up to frequent use of marijuana. So the participants we used for our study were all undergraduate students coming from a variety of sociology, communications, and economic related programs. They were a part of a bigger study, a survey that addressed athletic involvement in health risk behaviors, which specifically for our research, we were focusing on health risk behaviors comparing marijuana use and GPA. These participants were given a questionnaire where they were able to perform their own self-assessment, discussing information about their GPA as well as their marijuana use, and evaluating a range from little to no use to frequent use. We used 795 college students, and their age range is just average ages of undergraduate students, which includes 18 to 23 years old, and kind of an even distribution of ages between freshman, sophomore, junior, and senior. And more than half of these students were white, and the other half were a variety of other ethnicities. We had about even distribution between male and female participants. And then the information collected from this data set sample was then tested, and you can see the effects of that in our results.
Our study ran a Pearson's correlation analysis. Our hypothesis was that higher marijuana use correlated with lower GPA. To run this analysis, we recoded the marijuana use variable from the parent study provided in the codebook. The previous coding was labeled 8 for never using marijuana in my life and 0 through 4 as usage in the past 12 months. 0 being never, 1 being 1 to 2 times, 2 being 3 to 11 times, 3 being 12 to 50 times, and 4 being 51 or more times. We recoded the marijuana variable so that it was more continuous. 0 equaled never in my life, 1 was 0 times in the past 12 months, 2 was 1 to 2 times, 3 was 3 to 11 times, 4 was 12 to 50 times, and 5 was 51 or more times. Our Pearson's correlation did provide a statistically significant correlation. However, it was weak. The correlation between the two variables from our analysis was negative 0.135. The negative correlation shows that as the value of one variable increases, the other decreases. In this study, when marijuana use increases, college GPA decreases.
As stated earlier, our group was interested to discover the effects of marijuana use on college students' GPA. We hypothesized that higher marijuana use in college students would be negatively associated with a lower GPA score as a result of poor academic achievement. Consistent with prior research, the outcome of our study revealed a negative correlation. While the correlation was weak, we found that students who frequently use marijuana are more likely to struggle academically, which leads to a lower overall GPA score. Participants that reported no marijuana use within the past 12 months or have never used marijuana had a higher grade point average. Our scatter plot does a great job of displaying these results. Much like previous studies that examined the effects of marijuana use on academic achievement and GPA, there are limitations. Providing students with questionnaires that ask them to divulge information regarding their drug use and GPA can be difficult, as they may be hesitant to be completely honest. Self-reported data can impact a study's results greatly. In our case, students may have not been as forthcoming about their actual marijuana use and academic performance, even knowing that the data collection was anonymous. Additionally, it is possible for students to struggle academically because of other influences, not included in this particular study. While it is important to understand the effects of excessive marijuana use on a student's GPA and academic success, future research needs to examine the underlying causes associated with poor academic achievement.